I am Dr. Shukla. I have been practicing and teaching dermatology for last 45 years. To create awareness in public about the skin and skin disease, I have been posting videos on different skin diseases regularly in Hindi. Lately, I have realized that if this information is available in English language also, it will be more beneficial for a larger population in India and abroad. So now you can watch my videos both in Hindi and English. Today, my topic is vitiligo, which is also known as leukoderma or white patches. Today I will tell you about the symptoms, causes and types of vitiligo. I will also tell you about the diagnosis of vitiligo. Vitiligo is a common skin disease seen in about 1% worldwide population. But in India, it is about 7 to 8%. It's a very common disease in states like Rajasthan and Gujarat. Vitiligo is not harmful to our body in any way, but it's a big cosmetic problem and a great social stigma is attached to it. So these patients have a lot of stress. It's a general perception in the society that there is no treatment for vitiligo, but it's not true. Now we have different types of treatment by which vitiligo can be treated successfully, fully or partially. Vitiligo usually starts before the age of 40, but it can come up at any age. Children can also get it. The main symptom of vitiligo is white patch on the skin. It may be one patch or many patches. In the beginning, these patches are lighter than the normal skin color, but later on they become white. They are so white that we call them milky white in color. Vitiligo patches are smooth patches and there is no itching or pain on these patches. But on sun exposure, they can become red and they can cause burning. There may be just one or two patches or maybe many. These patches can be of any size, maybe just few millimeters or maybe many centimeters. Sometimes they can be so large that it can cover the whole back or chest or a limb. Vitiligo patches can be present anywhere on the body, but they are usually seen on the face, trunk, neck, hands and feet. There are different types of vitiligo depending upon the distribution of patches on the body. When these patches are present on both the sides of the body and are similar in shape and size on both the sides, we call it symmetrical distribution. This is a common presentation in vitiligo, but sometimes they are present on one side of the body only and do not cross the midline of the body. Then we call it segmental vitiligo. This type of vitiligo is usually seen in children and it spreads quickly but stops after 6 to 12 months. When the patches are seen on most of the body areas, we call it generalized vitiligo. This is the most common type of vitiligo. When they are present at a small area, we call it a localized or focal vitiligo. When the patches are present on terminal parts of the body like around the mouth, lips, eyes, nose, hands and feet, we call it acrofacial vitiligo. Vitiligo patches can be present only on mucous membranes like inside the mouth or genitalia, then we call it the mucosal vitiligo. When vitiligo patches are present on 80% or more area of our body, then we call it universal vitiligo. It's a rare type of vitiligo. Now I come to the diagnosis of vitiligo. Vitiligo is a disease of white patches, but it's not necessary that any white patch on the body is vitiligo. The most common disease which is usually confused with vitiligo is pityriasis alba. It's a disease of children where we have some white patches on face, but the color of these patches is lighter than the adjoining normal skin color. And it's not milky white as in vitiligo. Another difference is that these patches are covered with fine flakes or scales, where the vitiligo patches are smooth, they don't have any scaling or flakes. Another common disease where we have white patches is pityriasis versicolor. It's a fungal infection seen in adults on chest, back, shoulders and arms. Here there are multiple small patches of lighter than the normal skin color and they are covered with fine scales. So they are not smooth and not white as in vitiligo. In this case, we can see the fungus under microscope. Similarly, there can be patches of lighter skin color in leprosy also. But in that case, we will have other signs and symptoms of leprosy like loss of sensation. If there is some doubt about the diagnosis, whether this patch is vitiligo patch or some other disease, then we can confirm it by seeing under the dermoscope or under the Woods lamp. Woods lamp is a small equipment which emits ultraviolet light. Vitiligo patch will look bluish white under the Woods lamp. If still there is some doubt, we can take biopsy by just cutting a small piece of skin and seeing it under the microscope. Now we come to the cause of vitiligo. Well, we do not know the exact cause of vitiligo, but it is thought to be an autoimmune disease. By autoimmune, I mean that our body starts making antibodies against our own cells instead of outside invaders like bacteria and viruses. In vitiligo, our body produces antibody against melanocytes, and the melanocytes are the cells in the skin which produce melanin, and melanin gives color to the skin. In vitiligo, antibodies destroy the melanocytes and therefore melanin is not produced, and so skin becomes white. Now the question is, why a person develops autoimmunity? Well, there are many factors for that. One is genetic predisposition, which means genetically you are prone to develop vitiligo. And that's why family history is positive in 30% cases of vitiligo. But this doesn't mean that if you have vitiligo, your children will also have it. They may or may not have it. Because there are many other factors also which can trigger vitiligo in genetically prone person. We call them triggering factors. Now these factors are stress, diet, sedentary life, pollution, use of cosmetics, etc. If a person is having some other autoimmune disease like diabetes, alopecia areata, thyroid disease, pernicious anemia, SLE, etc., he is also likely to develop vitiligo. There are some chemicals which may trigger vitiligo. These chemicals are present in hair colors, plastic materials, cosmetics, skin lightening creams, etc. As far as the treatment of vitiligo is concerned, I can tell you that vitiligo can be treated successfully in many cases. I will discuss the treatment in a separate video. This is all for today. Thank you very much for watching the video.